below predetermined levels. The air in operating theaters should be kept at a higher pressure than in corridors and adjacent areas. This positive pressure prevents the flow of air from less sterile areas into more sterile ones. With regard to ventilation, various international scientific organizations recommend a minimum of 15 air exchanges per hour.
Infection control in operation theaters. The water distribution system in hospitals may constitute a source of healthcare associated infections caused by opportunistic pathogens such as Pseudomonas aeruginosa, Stenotrophomonas maltophilia, Burkholderia cepacia, Acinetobacter species, and fungi. Taps are common sources of Pseudomonas aeruginosa and other gram-negative bacteria and have ever been linked to infections in multiple hospital settings.
Immunocompromised patients are particularly susceptible to infection caused by waterborne microorganisms, which can cause bacteremia, meningitis, urinary tract infections, and surgical site infections. Surgical hand antisepsis with medicated soap requires clean water to rinse the hands after application of the medicated soap. Procedural and behavioral factors. A behavioral approach aims to reduce the number of airborne particles in the operating theatre through disciplinary measures. Simple and cheap measures include limiting the number of personnel in the operation theatre and restricting the movements of personnel in operating theatre to a minimum, as it has been shown that increased activity facilitates the dispersion of bacteria. Change the clothes before entering operation theatre. In addition to the number and movements of personnel in the operating theatre, adverse surgical events may be due to poor communication, bad operative technique, malfunctioning or improperly used equipment, and cognitive errors due to stress or inattention, all compounded by resource and organizational problems. It is important to emphasize that all personnel working in operating theatres, including surgeons, operating theatre assistants, anesthesiologists, and cleaning personnel, must follow hygiene protocols very strictly. Elective surgery on infectious TB patients should be postponed until such patients have received adequate drug therapy. When emergency surgery is indicated for a suspected or diagnosed infectious TB patient, taking specific infection control measures is prudent. Infection control practices. Standard precautions. All operation theatre staff should follow standard precautions. Hand hygiene. In addition to hand hygiene, surgical hand hygiene plays an important role in reducing SSIs. Surgical hand scrub. Surgical hand scrub can be done with medicated soap or surgical hand rub with alcohol-based formulations. Either method is suitable for the prevention of surgical site infection. Steps for surgical hand preparation. Steps before starting surgical hand preparation. Keep nails short and pay attention to them when washing your hands. Most microbes on hands come from beneath the fingernails. Do not wear artificial nails or nail polish. Remove all jewelry, including rings, watches, bracelets, before entering the operating room or the suite. Wash hands with a non-medicated soap before entering the operating room. Always use brush for cleaning hands if visibly soiled. Protocol for surgical scrub with a medicated soap. Start timing. Scrub each side of each finger between the fingers and the back and front of the hand for 2 minutes. Proceed to scrub the arms, keeping the hand higher than the arm at all times. This helps to avoid recontamination of the hands by water from the elbows and prevents bacteria-laden soap and water from contaminating the hands. Wash each side of the arm from wrist to the elbow for 1 minute. Repeat the process on the other hand and arm, keeping the hands above elbows at all times. If the hand touches anything except the brush at any time, the scrub must be lengthened by 1 minute for the area that has been contaminated. Rinse hands and arms by passing them through the water in one direction only, from fingertips to elbow. Do not move the arm back and forth through the water. The steps may be repeated 3 times and as recommended by hospital infection control guidelines. Proceed to the operating room or suite, holding hands above elbows. At all times during the scrub procedure, care should be taken not to splash water onto surgical attire. Once in the operating room or the suite, hands and arms should be dried using a sterile towel and aseptic technique before putting on gown and gloves. Correct aseptic technique should be followed to wear sterile gloves without contaminating the sterile surface. Protocol for surgical scrub with an alcohol-based preparation. The steps are same as hand wash. Hand hygiene training program for doctors, nursing staff, and housekeeping staff needs to be done regularly for each category of staff. Hand hygiene compliance need to be monitored. PPE. Please follow appropriate instructions on donning and doffing personal protective equipment in operating room. It is good practice to discard all used theatre wear prior to leaving the operating area to prevent healthcare workers, patients, and visitors from being exposed to the risk of contamination. Healthcare personnel or HCPs in all areas. Wear dedicated non-sterile attire. Staff should keep their movements in and out of the operating room to a minimum. Semi-restricted and restricted areas of the surgical or invasive procedure setting. Wear clean surgical attire, including shoes, head covers, surgical masks, and identification badges. Head cover or cap should cover the hair on the head and face fully when entering the operating room. Surgical mask should cover the mouth and nose fully when entering operating room if an operation is about to begin or already underway, or if sterile instruments or equipment are exposed. Wear the mask throughout the operation. Scrub team members are required to put on sterile gloves after donning a sterile gown. Use surgical gowns that are effective barriers to liquid penetration. Skin preparation for surgical site disinfection. Perform hand hygiene. Wear appropriate PPE. Use disinfectants, for example, iodine compounds, followed by 70%